Does angina always lead to a heart attack? Angina does not always lead to a heart attack. Long-term outcomes and life expectancy with angina depend on your individual underlying risk factors. There are a number of medical conditions and other factors which make people more prone to heart attacks, including cigarette smoking, lack of exercise, obesity, diabetes, and poorly controlled blood pressure or cholesterol levels. While each of these factors will increase a person's risk of having a heart attack, fortunately, many can be controlled. There are a lot of medications and dietary changes which can help to control diabetes and cholesterol, along with other types of medications and exercise plans which can lower blood pressure. Similarly, exercise and diet can also be used to help weight management. Several years ago, a large trial called the ischemia trial was conducted to look at the difference between treating narrow blood vessels with stents versus treatment with medications in patients with angina, coronary artery disease, and significant blood flow problems. If we look at the outcomes with medication, which is fairly standard treatment, the rate of heart attack per year amongst those patients was about 3% per year, meaning that 3 people out of 100 had a heart attack every 12 months. For this minority, a heart attack is obviously a major life-changing event. However, 97% of people did not suffer a heart attack that year, despite living with coronary artery disease and angina. If you extrapolate that out to 10, 15 or 20 years, even at that stage, the majority of patients have not had a heart attack. Therefore, although heart attacks do happen and they are significant, it's actually the minority who are affected, while most patients are able to live well with stable angina and coronary artery disease. Importantly, this study included patients with all of the associated risk factors I have discussed, and so the prognosis in terms of long-term outcomes from stable coronary artery disease is not bad. The most important thing is to recognize the full effects of the underlying heart disease so that heart attack risk can be managed. As such, it's essential to have an expert review which establishes the cause of a patient's angina and what can be done to reduce their risk of heart attack. This allows patients to focus on what can be done to help to reduce the risk and should also give them the understanding that the sensation of the angina, chest tightness and discomfort, is not in itself a sign that the heart is being damaged but rather an awareness of the underlying problem.